Okay, Deborah, so I understand you're concerned about getting adjusted now that we've diagnosed you with osteoporosis. You're definitely not alone in this because over 4 million other women also have this. But I do want to put your mind at ease and give you some statistics from a study. An 83-year-old man, the study was performed on him, who had a history of leukemia, multiple compression fractures because of his severe osteoporosis, and he also had degenerative joint disease as well. He came in with 10 out of 10 pain, which is the worst that you can have. And then after 8 treatments with a method that's a tool-assisted technique called activator. It uses an activator tool that provides a gentle click to help mobilize that joint. After 8 treatments of this, the patient was stable and remained stable for 4 months without spasms or tenderness in his spine. His Oswestry, which is a disability index questionnaire, it went from being 26% disabled to only 6%, which is phenomenal. And his pain went from a 10 out of 10 to a 4 out of 10, and he was able to start taking care of his wife again as well. There's also another technique that's very gentle that I like to use with my patients, and it is called SOT, or sacral occipital technique. There are no hard drops. There's very gentle movements with blocks on the table that help your body kind of use your own weight and gravity to help move into the position that it needs to be in. I find that very beneficial for my patients that not only have severe osteoporosis, but they're more concerned about getting adjustments. I find that to be very comforting for them, and I think it would be a great technique to use with you to start out with. And then when we see how we do with that, then we can move on to activator method if you would like, or we can stick with the SOT technique. And then from there, we can move on to very gentle adjustments. But I think SOT and activator method are going to be great for you. Do you have any questions about this before we move forward?